Hello, and welcome to the webinar, Managing Employee Health in a COVID World. I'm Dr. David Nace, Chief Medical Officer at Innovacer, and I'm so pleased to have everybody join today and have this great discussion around what are employees dealing with in this world of COVID around their health benefits. So with that, let me get started. I'd like to welcome my two panelists for today. First, start off to introduce Deb Henretta. Deb has a remarkable history, 30 years at Procter & Gamble as an executive, as a group president. And in her so-called retirement, Deb is vice chair of SSA & Company, the CEOs of the largest companies in America, trying to reimagine and transform their businesses, solve tough problems. She's a partner at G100, which is kind of a quietly known group of the 100 largest companies' CEOs and their teams, collaborating, doing peer-to-peer learning how to share their learnings about things like health benefits, and is one of the board of directors of so many companies that we know their name brands. To name a few: Corning, American Eagle, Staples, Sprint, and even Godiva Chocolate. So Deb, welcome to the webinar.
Thank you very much. I'm really glad to be here. Obviously, we've got lots to do in thinking about how to better manage employee health care, in order to create a better and more efficient and effective wellness system for our companies. So I'm glad to be here to talk about this today.
Super, super glad to have you. And then I'd also love to welcome Brandon Burkett. So Brandon is Assistant Vice President, Value-Based Care and Population Health at Orlando Health. He's been really helping to contribute to what has been a remarkable 4-year turnaround in Orlando, which is the leading value-based care organization, arguably in the Southwest. They built out, one of the largest clinically integrated networks in the Southwest. They have the largest accountable care organization for many of the top payers in the region. And for today's conversation, most important, is they have the largest direct-to-employer contract in the country with Disney. Brandon, welcome.
Hey, thanks for having me. I appreciate the conversation and look forward to kind of talking a little bit more about how these new value-based care models are probably being catalyzed more than ever based on the current challenging times we find ourselves in.
Awesome, awesome. So let's start this discussion and just turn to Deb. I think we have a big problem in this country. Healthcare costs have been rising and have been an unsustainable rate of rise, much faster than inflation. Is this what you see when you talk to the leaders of the companies you work with?
Absolutely. I mean, healthcare costs are one of the largest cost components now for companies when you move past, the cost of the good or the service that's being produced for sale. And, there's really no end in sight right now unless we start to adopt a value-based model. We've got to put more energy on the outcome of the healthcare solution and the preventative nature of healthcare problems in order to get those costs down, because the system that we currently have right now is unsustainable. I mean, it's absolutely unsustainable. And what it's doing is it's putting a burden on company profits, which makes the enterprise financially insecure or at risk, but it's also putting more and more of the healthcare cost burden back on the individuals, the employees, and obviously their families, as they have increased co-pays, greater contributions that they have to make to their healthcare. And even now, in a COVID world, we're even starting to see people shave off some of the ancillary care and wellness components. So, as I kind of look at it, really the leap that everybody has to make is really getting to better preventative care so that we can nip some of these healthcare issues early on before the consequences become serious and expensive. And we also need to be moving to value-based care, outcome-based care, so that we're rewarding and paying for things that are leading to healthcare success and not necessarily to stagnant, sending people doctor to doctor to doctor to try to find solutions.
Now, it makes a lot of sense. And Brandon, employers clearly are the biggest spenders on healthcare, but I think increasingly they've been frustrated with their healthcare experience. Has this been your experience with the employers you've been working with?
It has been, and locally we're hearing much of the same from coalitions and the self-insured employers, echoing everything that Deb just said. I think that um, what we're seeing is the traditional model, the TPA type brokered model. They're viewing that very much as a transactional relationship, not one that's based on performance, let's say. And you are beginning to get a shift towards a desire to see better outcomes. And the kind of paradigm or maxim that we like to say is that outcomes are going to drive your incomes in the future. So when we think about it from that perspective, you really can't do that without, using data, leveraging that data to turn it into information and being actionable to tackle things. There have been a lot of efforts, I think, by the traditional TPAs to put what I would kind of consider more blunt instruments in place to bend the cost curve. Things like high deductible health plans. I know we'll touch on those in a little bit, but those are really models that haven't been widely successful, and you're beginning to see them taper off quite a bit because they are really kind of relying on a couple probably problematic concepts. One is that there's perfect transparency in healthcare and we're all informed consumers and we're going to make the best bet and vote with our wallet, and we know that that's not the case. And the second is that healthcare spend is largely discretionary and that people will use those dollars only for things that they want to shop for, when in reality a lot of things that are built around an insurance paradigm are things that we aren't controlling for, but we can better manage in a holistic fashion. So everything Deb said is spot on, and I would say that the move to outcomes based care is something that we're hearing quite vociferously here in our market as well.
And if I could build on the great points that Brandon just shared with us, it's really sad when healthcare, which is one of the most important things to life, right? If you're not healthy, you're not in a good place. So, you look at it and then you look at these net promoter scores and you realize that, Amazon has an incredibly high net promoter score of 62 versus a 9 for healthcare. So I think that says there's a big, long distance that we have to go if you're a healthcare provider or a healthcare payer in terms of making the experience more satisfying and getting better outcomes for the patients, consumers, whatever you want to call us that are seeking healthcare.
No, that makes a lot of sense. And, it seems that, not to use an overused term, that this is kind of a burning platform for employers. They've been dealing with, how do I attract employees? How do I really make sure I have a healthy workforce and that their families are in a good place, that they can really focus and be productive at work, and yet costs keep going up and they don't want to sacrifice quality. Deb, has this been your experience working with the CEOs and CHROs around the country, that they've been trying to figure this out and are frustrated?
Well, I think they want to figure it out. They are frustrated. I mean, nobody wants to think that Amazon is like such a better supplier of healthcare than they as an institution or the healthcare systems that are supporting them. And I think, this has brought to an even more important, if you will, tipping point in this whole COVID world that we're now living in, because you've got a situation where people weren't happy about their healthcare previously. I think we all would agree, all sides would agree, that healthcare is just too darn expensive. And then you put on top of this very, very serious pandemic that we're all trying to sort our way through, and it just kind of creates a perfect storm, if you will, for healthcare as it relates to employers. And, you can look at that perfect storm as it's a disaster that's going to continue to happen, or you can look at that perfect storm as a tipping point for transformation. And so what I like to think is that we are at that tipping point right now, needing to work together to create a transformation in healthcare. And I think that's where, kind of this move to outcome-based, value-based healthcare, using more data and database systems to get more predictive on what the healthcare situation looks like for your company, what it could look like if you were able to leap into preventative care and not have kind of this continued increase of chronic conditions that we currently face in the U.S.
No, and we're going to get into some of that. Those are great points. Brandon, in your work with Disney and some of the other employers you serve, I would imagine historically their management of provider networks, the myriad of different types of entities they have to work with trying to get their different benefits together, and the movement toward high deductible health plans has not been successful. Has that been your view as well?
It has. In fact, they looked to disrupt the model years ago because it was a very passively managed network that, again, was really more of a transactional relationship about pushing claims to and fro as opposed to, actively managing the population in a holistic way. To kind of continue to reiterate and name drop Amazon again here, I think everyone likes the idea of Amazon and healthcare, right? High quality, cost competitive, consistent experience, delivery, great access that happens whenever you want it on a literally click of a button. I think that healthcare is evolving that direction, or will have to evolve that direction based on what we're hearing from the consumers, whether that's a traditional carrier or a self-insured employer. I think we can get there sooner than later. There's some principal tenets that Amazon focuses on that continues to engage consumers. They're constantly offering new services, whether that's, Prime Now or Prime Video or, their traditional fulfillment channels. They're constantly being competitive around cost and quality of products and always curating their network of what they're actually offering on the site. We can do that same thing on the healthcare delivery front. And then I think one of the things that they are probably the most advanced on is around leveraging data to make tailored purchasing decisions for you. I saw that you bought this, so you may be interested in that. The same is true for healthcare, right? And how we engage people has to be different and tailored and modified to custom to those patients. So we're hearing that. Certainly there's been other players in our market, but Disney's probably been the most vocal around changing the model, has really kind of been the spearhead, the tip of the spear rather, to try to drive those initiatives locally, but we're hearing it across the board.
No, and that makes sense. And having worked with Disney in the past, they've always been a leader to think about how they manage their benefits nationally. So this is great to hear. We've got a very targeted audience in the webinar of employers and health systems that have stood up their own self-insured health plan, if not just for their own employees. Let's check in with them and ask them a question, do a quick poll. What service or mechanism are you currently using to manage your employee health benefits? And please select one or more of the following. We would love to hear from you to see how you're currently focused on this. Are you using TPAs? Are you using some analytic vendors to create some dashboards? Do you have a platform that you built for a purpose that pulls all your benefits together? Are you using a benefit consulting agency, or are you using in-house benefit administrations? While we're waiting for the folks to weigh in on the webinar, Deb, I'd be really interested, when you talk to CHROs around the large employers, how are they thinking about the myriad of benefits that they offer, and how do they pull all that together and manage them to be effective?
Well, I think that they're rethinking how they look at benefits and how they look at the benefit packages. And the one, obviously everybody rethinks it slightly differently because they're representing different industries, they're representing different employee populations. But if I were to step back and say, what are the trends that I'm seeing when we talk with the CHROs? I think a lot of them are really putting emphasis on how they can get into preventative measures, preventative services, preventative systems that can help people stay on a path towards wellness, that can help people better monitor, better make lifestyle changes, wellness changes earlier on. And so you're starting to see a lot of things come into benefit packages where they're allowing for more preventative and wellness checks. You're starting to see them come in with some incentives. If you exercise, or you're involved in a exercise program of some sort and can give some proof that you're actually working in that, I think those are some things that we're starting to see. I think we're really starting to see companies and employers rethink the cost structure. So what can they do in order to get costs down, but service and healthcare up? And it's something at Procter & Gamble we used to call better and cheaper. Okay, we never wanted to put any kind of innovation out that wasn't both better but also had some sort of smart savings or productivity improvement, or in this case I think you'd put healthcare outcome associated with that. So I think those are some of the trends that we're starting to see. Those are two of the positive ones. Some of the negatives that I would say negative trends that we are starting to hear people talk about is a cutting back of some services. And that we don't want to get there, right? We don't want it to become such a cost prohibitive benefits package that people start looking at what they can drop out or what they ask their employees to pay for. So I kind of see trends on both sides as people try to wrap their mind and sort this whole thing out.
Those are great comments. I know in my work with large employers that are really cutting edge and really invested, they really understand that having healthy employees means a healthy company, and the company performs well. So, healthy employees absolutely means healthy company, healthy, revenues, healthy profits, etc. So let's check in with the audience and see where they're at, see if we have these poll results and we can pull them up. Oh, this is interesting. Most people are still relying on TPAs. Brandon, has this been your experience?
It has. So I wasn't surprised to see the two that were the most heavily picked here with TPAs and benefits consultants. I'm actually surprised it's not more. The others that are lesser picked here, I'm also not surprised. Those are probably evolving areas. To Deb's point, I think there are a lot of CHROs across the country, especially for the larger employers that are asking for this. But on the kind of mid-sized to smaller employers, they oftentimes don't have the in-house resources, knowledge, acumen, bandwidth, whatever you want to say, to really evaluate a lot of these options. So I would say, it's a little bit incumbent on the provider organizations as well to bring these new disruptive models to the fold to begin to better manage the populations as well. And it's not totally from an altruistic perspective. There's economic benefit to the provider groups for doing these types of things, but that value also accrues to the employers, the consumer. There is someone that's going to be disrupted, and we'll probably talk about that a little bit later too, when we get into the kind of economics of it. But I would say that if you're not seeing it in your market today, it's going to be coming. And if not, you probably ought to be thinking about it as a strategic decision yourself.
No, that's so exciting, and I know we've worked with you to build out a platform built for purpose for value-based care and serving your employers. So be interesting to hear about your work at Disney. We'll get into that. One thing I wanted to bring up though is, we've had this thing that has hit us called a pandemic, which has really created a lot of change for us in the market and thinking about things. Deb, what does this mean for employers, and how are they thinking about all the issues they have to deal with, not just about benefits, but the impact of the pandemic?
Well, I think it's causing us to rethink the way work gets done. I mean, put quite simply. And, that's a good theme for today, because we need to rethink the way healthcare gets done. We need to rethink the way work gets done. And all of these, in my mind, are leading to a need to be more data-based, to have more database decision making, because that's the only way we're going to get our arms wrapped around these issues. You can't sort of go on gut or go on sort of the general feel, the general trends. You're going to really have to start getting very rooted in data and analytics in order to kind of move the peanut forward and to reduce the costs. So that's where value-based care, outcome-based care really becomes a really important and central part. But when I think about, the impact of COVID, obviously there's impacts across all aspects of a company. Obviously beginning with whether you can be open, you can safely be open, and if so, under what circumstances you can safely be open. And obviously then there's this whole other incremental need that is both an effort and an additional cost of cleanliness, and making sure that the workplace is clean, sanitized, for workers, making sure that, precautions like, social distancing, wearing masks, there's a cost to all this. There's a cost when you can't have people be maybe as closely packed into cubicles as we got to. Maybe that's a good thing. I don't know, might be one of the bright spots of COVID. But, when you have to have people further apart, when you have to have people wearing masks, when you feel the need to have hand sanitizers and disinfecting wipes and all that around the workplace. I think there's also a rethink on what work needs to be done in buildings and corporate headquarters and corporate offices. And, I think that's going to have a lasting effect, because I think not only has it been the right thing to do to have people be home while we've tried to get our arms around the pandemic, but I think it's showing people that there's a better, more digital way to get work done. And I think there's a lot of companies that will not go back to the old way. In fact, I really, as I look at this whole thing, I don't think there is any going back to the way it was. There's only a going forward to, a new normal, and that will be very different. I think it'll have less people densely packed into central locations. I think you're going to see a dispersion of the workforce. I think you're going to see an increased number of employees working from home. I mean, obviously, you look at places like Google that, a month ago made the decision that they weren't going to bring anybody back until, a year later. So July of 2021, I believe, is their start date. So I think all that has a lot to do with going forward. And that will have some pluses and some minuses, and there will be some savings, but there will also be some additional costs, which then makes the healthcare costs even a bigger issue for companies trying to wrap their mind around it going forward.
Wow, so it sounds like COVID and the pandemic have been an opportunity for employers to rethink what is the nature of work, but also rethinking about what is the nature of health benefits to offer. So Brandon, have you seen the same catalyst for disruption from the pandemic in the way you deliver care and the way you serve Disney and other large employers?
Yeah, so there's obviously been a lot of benefits changes, both within the employer space and the traditional carrier space, opening up more access to telemedicine services and trying to be more accommodating to patients that may not be willing to go into in-office environments anymore. So, a little bit cliche term now, the new norm that we find ourselves in is beginning to, I think, make us rethink how we're going to actually deliver care. And I always go back to history is cyclical, and I go back to the 1930s black bag medicine, right? And we don't have to get back on the Pony Express to deliver care in patients' homes, but there is a way to become more commoditized in the way that to quote Clayton Christensen, to become our own disruptors, our own innovators prescription of how we begin to kind of evolve our care models. I think you're going to have one end of the spectrum. That's kind of the third bullet point on the slide we're looking at here, that will still continue to be the Mecca model, right? People will still continue to come to bricks and mortar facilities. You're going to need those. The other end of the spectrum, you're talking totally digital, but there's going to be something in the middle that still requires a tactile relationship, but may not be delivered in the traditional care settings we find ourselves in today. So I think that's where we're going to continue to see evolution, going from the Blockbuster to Netflix type, Kodak to, digital film type options where we disrupt ourselves. Certainly there are other players that are getting in the space, large PE-backed firms trying to jump on this as well. That you don't have to be, Nostradamus to read the tea leaves on this one. The consumer market is really changing its appetite for how they want care delivery, and all the other things we've talked about before, whether it's Amazon or the catalyst that is COVID. Consumer preference and choice is changing around this, and so we have to accommodate as a supplier to that resource how we're going to meet the demand of our market, of our consumers, our patients.
Well, Deb, these are such.
If I could build on that, I mean, it's not just the at-home care or providing of care that might be done by a doctor, because I do agree, I see things coming a little bit full circle, but it's also the increase of using digital technologies to develop more monitoring devices, more tracking devices, not, of your personal information, but certainly, aggregating things on a population health basis, which can help us better diagnose, better identify, better treat some of the issues, healthcare issues that we face. But I also think there is that safety or that notion of not wanting to bring people into places where bring healthy people into places where there are very sick people. And so this notion of having a segregation, if you think about it, the last couple of years, probably prior to some of these urgent care centers, but everything was starting to move to the hospital, right? Your doctors were all moving into medical centers that were adjacent to the hospital. And so you're bringing a lot of healthy people trying to do wellness activities, take wellness steps, and you're putting them on top of the place that houses the sickest people in the country or the world for that matter. And so I think this whole notion of remote monitoring, which can aid even the doctor so that there isn't even, in some cases, an interaction between the doctor and the patient except through virtual means, is pretty interesting. And I will tell you that I recently had reason to be sitting with one of the foremost dermatological thought leaders. And, he was talking about on the iPhone 11, they have an ability to actually look at a mole and with great certainty be able to determine if that mole is suspect and needs additional work or not. And you just think about if we keep advancing that system and you marry it with, okay, and here's what bad moles or bad skin spots look like, you can almost start to see where there's a world where in a remote context you might be able to get instantaneous diagnoses. You may have to have a confirmatory biopsy, of course, but we're just getting to a point where there's so much more that can be done remotely using data, using analytics, using some of these technology platforms, that it actually makes for kind of an exciting world to look forward to. And I don't think we're far away from it.
Yeah, it sounds like there may be a silver lining to the pandemic that helps to advance a lot of these technologies and rethinking of new ways to really offer better service, more quality and lower cost for not only healthcare in general, but for employers particularly, since they cover most of the healthcare in this country. So let's get into a little bit of learning about Brandon's experience at Orlando Health. Brandon, can you tell us a little bit about Orlando Health as an organization?
Sure. So, the major points here, we are a organization based in Central Florida, 11 hospitals spanning both the Central Florida market in Orlando out to the West Coast in Tampa. All told, we have about 5,000 providers that participate in our clinically integrated network. And David, as you mentioned, that makes us the largest clinically integrated network in the Southeast US until you get to our friends up at Vanderbilt in Nashville. We are managing about $1.5 billion in spend across contracts that we have with all the major carriers: Aetna, Blue Cross, United, Cigna, Medicare, and then a large number of employers here locally. All told, we're getting close to about 275,000 lives now as of just recent, and we're managing that population across these contracts since 2013, and all told, we've saved about $150 million in savings over that time period, and about 90 million of that has come back to Orlando Health as incentive. And that a lot of those dollars go to fund our operation here, but also to incentivize the physicians for their good work.
Wow, it's quite an organization, Deb, don't you think? I mean, they're doing incredible work.
I do. And I think this is, what Brandon has just outlined, I think is, sort of the path that many, many healthcare systems and employers are going to have to get on. And it's also the way of the future. So Brandon, congratulations. It's, obviously any kind of work in this direction with these kinds of outcomes is really spectacular. So good for you.
So Brandon, I really want to ask you the million-dollar question, no pun intended, that many people have when it comes to population health and value-based care in general, which is, and help us think through this, why would anyone spend $1 to save someone else $1? So, I mean, this is sort of the big question in value-based care is why would you do that?
Right. Well, yeah. It's not totally altruistic. There is economic benefit in it, and someone is going to be disrupted. But the general winners in the situation are the supplier, in this case, the provider, and the demander, in this case, an employer or a carrier. But there are other competitors in the space that are other suppliers that also lose out. So the whole, I would call it a more draconian view of value-based care is I'm spending money to save someone else money, and then I only get half of that money back. That's a business proposition that's going south really quickly. Well, what I try to do is I try to show this slide to most people that don't fully understand the economics of it, which if you're looking at the left side of the slide, consider this pre-value-based care, before you've entered into a market. You have an organization, a BBC organization represented by the yellow slice here, that's earnestly interested in getting into that space, whether that's to differentiate itself from other market competitors or because they believe there's strategic value in it, or maybe it's just aligned with their mission and the vision of the organization. On the right, you have the post BBC kind of experience once you've actually deployed those services and the outcomes that have been delivered to the population. So on the left, $100 total spend. Let's just say I'm a large employer that spent $100 a year on my population, and my organization, one of the organizations is a BBC organization, and they make 40% of that, right? So if you look at the table at the bottom, that would traditionally be captured as a top line net patient service revenue, $40 captured. And then you have expenses that offset against that. In this case, let's just say you're a highly profitable organization 20% operating margin, just blowing it out of the water. So you have $32 in expense. So right there, you have $8 in what we would consider operating income, here listed as the fee-for-service operating income. That drops straight to the bottom line, $8, everyone's happy, high-fiving, great, kumbaya. But you're not really doing anything to change the shape of the pie here. And you're also not benefiting the employer or the consumer by driving value that you could then also reap back to yourself as additional funds. And so what the pie to the right is supposed to represent is that we've been able to shrink the size of the pie. We went from a $100 spend to $90 spend. And so right there, the employer saved $10 year over year compared to what they spent previously. All the while, because you've been able to cut fat throughout, the network in terms of overutilization of ERs and unnecessary imaging and things like that, you've actually been able to reshape the pie and create stickiness within your clinically integrated network. And the byproduct of that is now you're getting 50% of the $90. So your top line revenues increased, same operating expense. So let's just say 80% expenses. You've now had $9 in operating income versus a previous $8, but that's the cake. There's icing too. The icing then is the $5 that you get. Let's just say you're at a 50% sharing rate on the savings. The 50% savings on $10 is then an additional $5. So you can see you made $14 in that situation for every $90 spent, as opposed to 8 out of 100. All the while, the employer only spent $90 plus the $5 in incentive back to you. So they had a 5% year over year savings with probably much better quality and better outcomes for the patients as well. So that's kind of the thing I like to present to people to debunk this myth that volume and value have to compete with each other. Oftentimes value drives volume, right? It's just like the Amazon notion. Again, we better be getting paid by Amazon for this presentation. But the more value you drive, the more business and more commerce you're going to get, right? More people are going to want to shop through your site. More people are going to want to traffic your stores. So that's the kind of high level economic notion around this.
Deb, these are great insights. What normally seems like a losing proposition, spending $1 to save someone else $1 and getting 50 cents back, means you actually make more money, and the person you save money with is getting better service and better quality. Amazing.
Yeah. And who wouldn't want that? Because in the end, most business entities, unless you're a not-for-profit charitable organization, most people are in the business to make money, and they're either making money for themselves, their shareholders, or their investors. And so, sorting through and solving this is one of the most critical things. We've come full circle to what we said at the beginning of this, is these are, cost issues that need to be controlled, need to be addressed. And so I think this gives us a really interesting model to think about it. The other thing that I would add is, I think a lot of companies, I mean, maybe increasingly fewer, but there's so many companies out there that actually think they can do it themselves, right? So they're like, well, I know best, I can fix this, I can get the cost down, I can use my network to do it. And the thing that I would say is data analytics, the collecting of data in HIPAA-proof, HIPAA standard ways is getting increasingly difficult. And so one of the things that, I spend a lot of time counseling and talking to companies about is, don't do yourself, don't try to build yourself something that somebody else can do better, or that somebody else has the better systems or the better data or the better universe of data to get the job done. So I think there is an element of, get the help you need when you need the help. And I think we all have to acknowledge, in this world where digital, the internet, technology is moving at such a rapid rate, we can't be experts in everything. I just had a conversation this morning with a small company, and it even related to sales. And it's like, yeah, well, they've got a sales organization and they've always done sales their way and they've always been successful. Well, guess what? There are a lot of tools out there that can help you improve your sales performance, improve your rate of sale closure, increase the rate of purchase. And so it's like, why? And you can't build it as well as the people that are out there that have already built these digital systems. So I think healthcare actually has to come that path too, and recognizing that they can't do everything on their own, that they will need partners, they will need sophisticated data systems. And those aren't necessarily things that a healthcare system is or can be or should be expert at.
Now we've been so thrilled to work with Brandon and Orlando Health around data analytics, dashboard, and building a platform for them to achieve just that for Disney and other employers. So Brandon, tell us a little bit about how you think about this when you're building a direct to employer risk contract. What are the things you need to think about, very briefly?
Yeah, so it always starts with data and data modeling and understanding where you have opportunity and where you think there are risk. And so, you're not going into risk for risk's sake. A lot of people look at risk as a dirty 4-letter word. It's really just a mathematic model of understanding how much exposure you have. And so fortunately, we've been able to use the Innovator platform to manage the population. But, prior to that, we use the tool to understand what our exposure would be. And so if I'm looking at kind of the general kind of 4 corners of a deal, a risk arrangement, these are some of the buckets that we look at here at the bottom. Broadly speaking, financial targets, risk maximums, risk corridors, or sharing rates. Or said another way, each one of these headers would be how you're measured, right? The financial targets, how much exposure you're willing to take on, the risk maximums, how do you color that risk, the risk corridors, and how do you share in success and loss with the organization that you're participating with. And so I won't go into detail of each one of these, but there's plenty to read here, and I'm sure the slides will be sent out after the presentation. But there's lots of different things that you can do and levers that you can pull. And generally speaking, I would say that most employers and insurers that are getting into the space and going into it in a collaborative effort will tend to be more provider favored in these models, because you are stepping up to the plate to take on risks that you wouldn't otherwise have in these types of models. But these are ways to begin to insulate yourself from a little bit of risk or create a glide path to those models. But again, it all starts with data. It all starts with understanding where your exposure is and what you're going to be able to do from day one to go after the proverbial low-hanging fruit.
No, those are great insights. And there's always this quandrum of like, what do I measure? What makes sense for me to like create a dashboard around? What do people need to see? How do you think about the information that needs to be presented to be successful in this area for you?
Yeah, I think there are, run-of-the-mill KPIs that people look at in terms of rates per thousand, utilization, and PM cost, and there's different benchmarks you can hold yourself to. But in terms of, entering, again, the 4 corners of the deal from the quality and reporting perspective, which is equally as onerous as the cost management and care management aspects of it, you have to make sure that you are being very selective about the measures that you're going to target, making sure that the measures that you're picking are actually things that are going to bend the cost curve, are going to improve quality in a market way, not just check the box measures, but truly outcome measures. And that's really something that we're hearing more and more frequently from the payer partners that we work with. We don't want to just know that you did a screening test. We want to know that the hemoglobin A1C is dropping precipitously because you're doing things to manage the diabetic population. So we're moving more and more toward that direction. There are a lot of kind of lessons learned here on this slide around how you select the measures, what measures make the best fit for your organization, how do you do the reporting, is there attestation, what's the right size of the measures. So those are all, these are different deal points, I guess, if we had to distill it down to it, that you need to kind of think through each and every one of them. And there's probably another dozen or so that you would have to think through as well as it relates back to the financial measures and the utilization measures. It really is more of a, you've seen one direct to employer deal, you've seen one direct to employer deal. It really varies with the population you're managing, and you have to really meet the employer where they're at in terms of meeting their expectations on both cost and quality.
No, that makes sense. And we often work with you to talk about value levers. What's the key value lever to focus on now or focus a KPI on? But then also they change over time, don't they, with your population?
Don't remind me. Yes, they change all the time. So we have to be nimble, and we have to be able to better manage the population, have the data insights. And part of the change too is also knowing what you're going to be changing to. So we don't go into a change blindly. We go into it with optics around, do we think we can perform in that measure, and what do we need to do to improve once we hit the ground running on day one of the performance period.
Well, these are awesome insights. I guess one question is, you're also managing the care themselves, and do you do that alone, or do you do that with a TPA, and how do you think about it?
Yeah, so I'll just use our Disney relationship as an example. We have other relationships that are similar to that, but Disney does have a TPA. I traditionally kind of would distill a TPA's role into 4 very high level functions. A TPA designs a network, they set rates with the provider in that network, they do utilization and care management of the network, and then they actually adjudicate claims. They're passing dollars to and fro. Our relationship with Disney encompasses the first 3 of those 4 things. So we've designed our networks at the rates of the providers, and we do care management. They still have a TPA that sits in place to actually do the adjudication of claims and pull dollars out of Disney's bank account and put it into the pockets of physicians to and fro, right? So we've entered into that arrangement eyes wide open, knowing that we had to go orchestrate the network arrangements and set the rates and take on the care management responsibilities. That said, there's still a lot of stuff that the TPA does outside of those 4 things. They still do utilization management. They're still doing, call centers and concierge lines and things like that. So we kind of have to have a division of responsibilities document, if you will, so we understand very clearly who owns what in the member experience portion of it, and the care management portion of it, the utilization management portion of it. And so again, that's going to be a very circumstantial discussion as well. It really depends on the capabilities of the TPA and the expectations of the client that you're working with to try to meet those cost and quality aims. There's a lot of things that we may want to own as Orlando Health that we feel are deal breakers. We're not going to take risk for this population if we can't do X, Y, and Z, because we don't want to relegate those responsibilities to a party that we don't control. Likewise, they may feel like, hey, we don't want to, incentivize you on something that you're not really doing. So it really becomes down, again, a little bit of matter of negotiation around what's the best fit for the model, and understand the capabilities and compatibility between all the players that are at the table to make sure you meet those results.
This is such great insight, Deb. There's so much that learnings and experience here that we're hearing. I would imagine many of the employers that you work with would love to sort of take advantage of this and start thinking of, do I need to work so much with middlemen and different vendors, and maybe I could work directly with a health delivery system like Orlando Health is doing.
Yeah, and I think that's a conversation that we're starting to see. So, to come full circle on this, first, Brandon, thank you for sharing all of these insights. You are sort of the trailblazer, if you will, in a lot of the, kind of work and thinking that is being acted on here. And, what I would say is, I think there are more and more people looking to explore models similar to what Brandon's been talking about, because it's viewed as one way to get to lower costs, as he walked through in his model. And lower costs, not in the straight out, I might spend a little bit less, but in the way that you can think about leveraging value and volume. I think that is a really neat new way of thinking about that. And then, I think this is becoming a topic of conversation. And, even some self-employed companies, some of the largest companies that end up, with self-employment or self-insured healthcare type systems, what you find they're working towards is they're looking to do these kinds of breakthrough, probably in their cases, experiments to try to see if they can, make this work for for them as an employer as well. So I think it's something that we're just going to start to see more of. People will experiment, and the experiments that generate lower cost and better outcomes are going to be the experiments that work.
These are great.
If I could just add to that too, David, I think, one of the points that struck me was the lower cost comment. Deb's absolutely right, but I want to clarify too, for a lot of folks, a lot of people tend to think that that's a race to the bottom, a rate cutting exercise. And what's probably lost on a lot of people is that you can actually raise rates or set higher rates, and employers are very receptive to this in many cases to drive value. And just real quick on that, people are looking as much for anything right now as budget certainty as anything else. And so when we talk about costs, we're not always talking about the per click fee that you actually have to pay for each service, but the longitudinal cost of care delivery. So if I can tell you that today you're paying $25,000 all told for a knee replacement plus the skilled nursing facility, et cetera, but once out of every 20 times you have a patient that costs $200,000, there's outlier risk that's associated with that. Now, if I told you for $26,000 for $1,000 or $2,000 more per case, I'll eat all that cost to give you budget certainty. I'm essentially giving you a care warranty of sorts that says, you are going to pay a little bit more up front, but you get all the lube changes, the tire rotations, everything's included for life, and you don't have to worry if your transmission blows out, because that's all covered. And those are the types of package deals that I think you're seeing more and more prevalent, especially on the bundle payment side. And employers are certainly looking for those as well on the episodic front, because those tend to be some of the higher cost cases and some of the more prevalent cases too.
Now, the work you're doing really is providing a light at the end of the tunnel, I think, for this rising costs and unsustainability. Let's check in with our audience and see what they're doing around their benefit management approaches for their own employees or for any direct-to-employer contracts that they're doing, or for employers, how they're managing their benefits. Just select one of the following. Are you using virtual care benefits given the movement toward telemedicine and remote monitoring, providing better quality of care? Are you using employee navigation services so they can manage and be aware of all the benefits they have, wellness and care management benefits? Do you find chronic condition management programs to be the most effective? Is it the need for data and analytics and dashboards for tracking metrics the way Brandon's talked about? Is that your effective strategy? Or are you trying to focus on just educating your employee base and giving them decision support tools to manage their own health? So while we're checking on that, Deb, what's been your experience about how the employers you're working with, what tools do they see as the top 2 or 3 tools to manage their benefits today?
Well, I think the one, first of all, everybody is starting to get with the data program, right? So I'd say analytics and dashboards are things that a lot of people are starting to make movement towards. I think people are coming along the lines to these chronic condition management and the navigation services, which, I think they can start out sort of one and the same at different points. And then I think COVID is just pushing the virtual care. So, these are all important tools. I think depending on your employee base, your particular, healthcare profile, if you will, to your organization will sort of guide which of these become most important to you, also considering your starting point. So it'll be interesting to see what people have to say about this.
Well, let's take a look, see if our poll is done. We can bring up the results and find out. Wow, it's all over the place. So,
wow. Well, it says they're all important, but
absolutely.
Very interesting to see that big push on virtual care. I wonder if, 8 months ago, it would have been 65% or maybe something a little bit less.
Brandon, your thoughts? I remember years ago when chronic condition management seemed to be that was the strategy, and now we see more movement to doing other services as well.
Yeah, I would agree with Deb. All these are important things. I would actually tend to think that the analytic and dashboard reporting is probably the most important because it helps give you visibility into all the other areas that you want to tackle. Going back to kind of the mantra of analysis greater than anecdote. We want to manage these populations and manage them effectively, but without having the data insights, that's a challenging feat for certain. Obviously, chronic care management programs are extremely important, knowing, some of the stats we presented earlier, 5% of population drives 50% of cost, and it's really the Pareto rule around who are the high cost members you need to curb. I would say I would 100% echo the Deb sentiment there as well around virtual care. We were a virtual care shop. We actually had hundreds of remote patient monitoring kits and a whole virtual visit platform prior to COVID. But as of April, we've 10,000% increase on our actual virtual visit utilization across the market. So we've had a huge uptick there. It was part of our strategy before, but it certainly wasn't a leading strategy. And that's obviously evolved with everything that the pandemic has brought onto us.
No, this is fantastic, and the discussion's been great. Let's kind of summarize the strategies for success we've been talking about today. I think first we can talk about, looks like I lost my screen here. Can you guys see? There we go. Okay, so just a summary. This is a survey by Willis Tower Watson, one of the leading, if not the leading benefits consulting firm. These are the different strategies being used today. Really a focus on affordability and cost, culture, pharmacy costs have been a big one. We haven't gotten into that. The use of technology like virtual care. So all the things we've been talking about. Brandon, you've done a great job of summarizing the need to have actionable insights. So data and analytics, as you said, is really the key strategy that's going to be needed to really move forward with this and predicting what will happen because things keep changing, as you alluded to. Offering targeted programs for the chronically ill still seems to be a very important piece because that 20% of people drive 80% of the cost, and we really need to focus on keeping them well, and then also helping the wellness and other benefits to really help, provide personalized education and make employees aware of what their benefits are. So let me kind of go back to this issue, Brandon, you brought up now. The need for unified reporting, analytics, this seems to be so critical to the success that you've driven with Disney and other employees.
Right. Yeah, I think having a centralized platform, which we use Innovacer today for this, for cost management, quality reporting, risk coding, everything in between from a pop health perspective. We're doing all this type of stuff in a centralized platform because absent that, it becomes a very difficult challenge to manage. And going back a couple slides, you had a bullet point there regarding moving away from kind of retrospective, right there, the retrospective kind of more descriptive reporting, which is interesting, but it's kind of like driving a car using the rear view mirror. You're making decisions based on things that have happened as opposed to using more real-time and predictive tools. And I don't know that I'm there yet to believe that the tools that we have in place today broadly across the whole population health ecosystem of all vendors that I've seen are accurate enough to know what each individual patient's going to do. They're getting better, but a lot of times these predictive models are only as accurate as a coin flip. But what we can begin to do is begin to cohort patients out and to understand that while each individual patient is a statistic, they play a bigger role in the overall statistics of populations. And we know that a certain portion of ESRD patients are going to be extremely high cost in the course of a year. I may not know which one of the 15 marbles in the bag is going to be blue, but I know one of them is going to be blue. And if I deploy my care management resources and standardized care protocols to all 15, I'm assuredly going to drive better results than I would be if I was trying to just shoot blindly. So, I think having the centralized data platform that is, Innovacer for us, and others are using different platforms, and, a lot of this time is leveraged out of their EMRs. It's useful to be able to marry together kind of all that disparate data to get a better, more comprehensive view of your patient, and then apply these types of, modules and predictive tools on top of to manage those populations more comprehensively.
Yeah, no, this is great. And we've got a lot of questions coming in from the audience. And one of them really is, what are some of the strategies you use to think about chronic care management?
Yeah, so certainly for each disease state, it varies a little bit. So we've done a lot of work in terms of clinical transformation for heart failure, COPD, diabetes. Every one of them has a little bit of a different, flavor that you have to tackle. Certainly one of the biggest ones is transitions of care and making sure when those patients leave the facilities that they have post-acute visits. We've done things around patient concierge, where we're actually doubling the rate of patients getting into follow-up visits within 7 days post-hospital discharge, reducing no-show rates. A lot of it has been revising, as simple as this sounds, a lot of our educational collateral, making sure patients are going home with 30 days of prescriptions in hand, taking away some of those socio-determinants of health barriers, that not having to make someone have to choose between their heart failure medication and paying their electric bill. One of the first things we talked about, and this is probably one of the biggest areas we can probably tackle as a population health entity, is a lot of healthcare outcomes have nothing to do with care delivery and have everything to do with your environment, your behaviors, and all the other things that go along with it. And we talked about, I think in the very first slide, that the US spends 20% on GDP for healthcare, but the other countries are spending half of that, but they're also spending another 8 or 9% on social services and wellness services and things like that. So that's where I think we need to begin to reshape the pie of American spending, and that's specific to the chronic care population for sure.
Yeah, and that kind of speaks to this issue about needing unified reporting and analytics and how things change over time, what you need to focus on. And Deb, I know you and I have spoken in the past a lot about how the social determinants of care and the behaviors of the individual patient, what drives them, motivate them, are really the biggest contributors, and we need to get our arms around that, don't we?
Right, and that's another place where, I think data and observation can help, because, you can use data to try different things with different populations of people, and some people spark to some methods and other people spark to other methods. And the more that we can start to aggregate data around what you've tried, what's proved successful for what types of consumers, I mean, you can really get to a level of sophistication, to bring our friends in from Amazon again, a level of sophistication in healthcare that Amazon's been able to get with our shopping behavior. And if you think about it, gosh, isn't it a shame that people out there know so much more about what we shop for, and yet we don't know enough about our own health and our own vitals at any given moment? And I just sort of like wrap this all up. There's there's folks that have studied industries, and they have sort of plotted the progression of industries to digitization and to data and analytics. And, you know, about maybe 5 or 6 years ago, someone did a study, and they came out and they said there were 2 industries that were horribly lagging. And the 2 industries were healthcare and banking. And the irony of this whole thing is our banking, our money, the money that we need to live and survive, is now gone largely online. You think about it, you're not bringing money to a teller anymore. I mean, so much of it is digital, it's done online. And, you know, here we sit with healthcare still being now kind of the lone industry that really hasn't wrapped their mind around digitization, around use of analytics. And again, I keep coming back to, these are not capabilities that are going to be core to every health system. Health systems need to be focused on the care and the wellness of the patients that they're serving. And so that, the analytic help that you need to really find the insights and find the answers that can drive wellness and drive costs down.
That's exactly what we try to support here at Innovacer. This is a little framework of how we think about things here and how we support folks like Orlando Health. Is how do you bring in data from all these different sources, including the social determinants of health and the community health organizations, you know, down to the level of not only the zip code they live in, and maybe unusual sources that we've thought about in healthcare, like credit scores, but also, you know, getting input from individual patients about their unique situation and what motivates. Pull all that data together, unify it, ensure the quality of data, which Brandon spoke to earlier, being so important, and then being able to make that data available to all the folks that are taking care of patients, including the patient and their family. How do you support the physician, make it easy for them? How do you support the care manager? How do you support the folks that are running these value-based care programs, and have them work together as a team with the patient and their families? And it's really creating that sort of Amazon-based or Google-based app store to be able to start to provide the exciting experience we all know and love when we use our smartphones and use these applications that give us insights, actionable insights, and that change over time. So this has been great. How do you think this sort of framework, Deb, when you've seen the work you've done with Innovacer over the past 6 years, because you were with us from the beginning, how have you seen this help across the, from your perspective, with the health systems we've been serving? Have you seen this approach been helpful?
Well, you know, first of all, when I watch the way we have evolved, the sophistication, the technology, the data platform, the services that we are able to provide, it's been really tremendous. And I think we're starting to see the living proof of that with the case study that Brandon walked us through. You know, I also look at this and just say, what you love about it is its database, it's integrated. And the other thing I would add is it is privacy protected, okay? Not every solution out there has the care and due diligence on the privacy and security aspects that I've seen, you know, Innovacer do. And so those are the things, as I look at it, that really kind of jump out to me. The patient orientation, patient-centric, care-centric, focus on outcomes and focus on wellness. Really looking to keep costs in control, and then and find productivity opportunities, and then finally just putting it all in an era or under the aura of privacy, which I think is so important in today's world.
Well, that's a great closing comment. I've been weaving in questions from the audience as we've went through these slides. So, you know, Brandon, thank you so much for joining us and giving these incredible insights from the work that you're doing at Orlando Health, serving large employers in the region, and really having a win-win benefit for both large employers and the health system and the doctors. Everybody is really just winning in this situation. And Deborah, thanks so much for coming on and sharing your perspective as the employers that you represent in the G100, SSG, and the other work that you're doing. This is awesome. Thank you so much, and appreciate you both coming. Thank you, Deborah.
Thank you. And thank you for leading such a good event.
Thank you so much. Thanks, Brandon, for joining.
Thank you. Take care.
And thank you for everybody for joining this webinar. With this, that concludes the webinar, and thanks everybody for attending. This has been a great session. Appreciate it.
Stay healthy, everybody.